Good morning, good afternoon, or good evening, depending on where you are in the world, and welcome to today's presentation, How to Achieve Better Outcomes Through Patient-Centered Care. My name is Matt Brady. I'm Head of Content Healthcare at Informa Markets in Dubai. Now, just before we begin, at the right-hand side of the webinar window, you should see a Q&A box. So this is an opportunity for you to ask one of the speakers a question that will be addressed later in the webinar. There's also a series of poll questions that we'll be asking. Now on to today's session. Our speakers today will address three important perspectives of patient-centered care that include how patient lives are improved and costs optimized by equipping clinicians with the right tools, how medication decision support integrated into the EMR reduces clinician burnout and error, resulting in better patient outcomes, and how today's digital health solutions are changing the patient-physician relationship for the better. Now, it's my privilege to be joined today by three speakers. Dr. Ahmed Abdali, who is a Saudi country manager at Wolters Kluwer Health, followed by Christian Ciela, Vice President Clinical Effectiveness, also at Wolters Kluwer Health, and third and finally, Dr. Sarper Tanli, who is Saudi country manager at Wolters Kluwer Health as well. So welcome all, and thank you very much for your time. Now, if we could begin with the first presentation, which is to be delivered by Dr. Ahmed Abdali. Over to you.
Thank you, Matt. And all are welcomed. And I'm really pleased to be with you today to discuss and go through actually how we can really driving a better outcomes to our patients, to our healthcare system through using the evidence-based medicine. So today with you, Dr. Ahmed Abdali. I'm the country manager of Wolters Kluwer Health, a clinical effectiveness business in Saudi Arabia. So for sure, to start such a topic, we would like to highlight what is actually the main challenge in the Middle East, mainly as well as in all over the globe, the healthcare are facing nowadays. So as we can see here that we had one report was raised by Ernst & Young healthcare survey that shows that 51% of healthcare professionals in GCC countries rated that overall healthcare quality are or as inconsistent, which means that we can see that there is a huge variability in care delivered and addressed to these patients who are living in the Middle East as well as Africa. Yes, there is no that much evidence or research showing this information, but also we had one more research done by Harvard Business Review in 2015 shows that almost 7% of all hospitalized patients experience a really preventable medical errors, and more than 1/3 of the patients are dying as a result of therapeutic and diagnostic errors. And this accounted for the vast majority of the patients. So starting from the challenge, then what we are really facing make us to change or redefining our healthcare delivery, for sure, not only in the Middle East, but even around the globe. So as we all know, what actual main healthcare challenge we are faced, one of them are universal coverage as well as access to the healthcare by the patients. And we believe that the Middle East region, mainly GCC countries, had really played a good role to support the accessibility and the coverage for their patients. But still, we believe that's not enough. And then we had introduced other issue, which is the core issue of our healthcare system toward the invariability of care as well as inconsistency of care or healthcare delivered is actually the value of the healthcare are delivered. So for sure, and very quick, what we mean by the value of healthcare, what exactly mean? We can use Michael Porter, the Chief Strategy Officer of Harvard Business School, terminology when he defined that the value actually is the patient health outcomes per dollar spent, as well as there is a nice calculation shows that the value should equal the health outcome that really matters the patient, and the patient believes that this is the right outcome and the value he's looking for, divided by the cost of delivering these outcomes. Last point to explain how really the value healthcare can be really delivered in the healthcare system by showing how really we need to measure our care. So usually we need to measure our care through the full cycle of care rather than just seeing the patient as a silo all over the healthcare delivery. So usually we need to measure the full outcome through the full journey of the patient we have, as well as the full cost of the patient through the full journey from day one he entered to the system or the healthcare system until he went back to home. So from there, Wolters Kluwer clinical effectiveness business assured that we can support this redefining healthcare for sure strategy or system toward more value concerns by introducing our four main solutions, starting with the UpToDate, which is actually the gold standard evidence-based tool used by the healthcare providers, mainly physicians, to really support them with the right evidence-based materials and information to treat their patient. And this now are used by more than 2 million healthcare providers all over the world. Then we have Lexicon, which is a referential drug therapy information that improve really decision-making for the healthcare providers, mainly who are dealing with the drug administration, as well as pharmacists, nurses, any healthcare provider who are really dealing with drugs and administration, he can for sure access our Lexicon solution so he can reach the right decision. As well as we have our third product, which is Medispan. I believe that this is a normal transformation from Lexicon as just a drug referential solution to an embedded solution into the workflow of the doctors and healthcare providers to support them with the right medication alerts, as well as to secure that they are reducing any medication errors happen in the hospital by using our Medispan solution. Last but not least, EMI, which is mandated for patients to empower them with the right knowledge and to engage them more with the healthcare providers. Here's a slide, a very quick view of how the Middle East actually systems or leaders are seeing the needed actions they need to take and the main pillars they need to take to reduce these clinical variability, as well as to enhance the value-based care in their entities. So starting with, for sure, improve the care quality. This is one of the main pillars they are working on, as well as improve patient outcomes, as well as improve the clinical outcomes from using such important tools like what we are offer as a CDS tool. Last but not least, as well, manage the cost for the all healthcare systems they are working in. So what's actually our real strategy? So from day one, we agreed as a CE business in Wolters Kluwer that we need to reduce the clinical variability all over the healthcare system, all over the globe. So by introducing and offering one-stop shop for different audience at the healthcare setup, as we just explained, that we are serving the patient, the doctors, physicians, nurses, pharmacists, we believe that this kind of support for all stakeholders will add a big value for sure to the patient at the end. Also, we believe that to use the products with the same playbook as well as the same editorial team, this will give as well highest harmonization between our products. As well as we can see that our solutions, the four solutions, are integrated together rather than to be disconnected products. So we will make sure that the doctors and all healthcare providers are reading the same playbook and they are reading the same information through these products. Last but not least, we are also promoting our lovely clients to really integrate our solution in their EMR or HIS system in the hospital so they can easily access these products or technologies, as well as to support them to improve their healthcare quality. As you can see as well in this slide, we are showing how our four products are engaging in the full care scenario of the patient journey, starting from emergency department or outpatient department until he discharged to home. And by introducing our technologies and digital technologies, we can for sure reduce the cost as well as increase the efficiency, better care quality, and reduce any medication error, as well as to make the patient satisfied. as you can see, here is one of our researches done in Singapore National University Hospital, reported that using of up-to-date as well as the digital technologies like a CDS tools, it's really changed the doctors and the healthcare provider decision toward their patients by 37% of the time when they are using such a tools like up-to-date. Also, as you can see, we have one slide which is showing a research done in Japan, which shows that the people or the group in the hospital who are not using a CDS tool depend on the evidence-based materials and digital tools support them to take the right decision. We can see that they are having almost 24% diagnostic error rate. If you compare it with the people or the other group of healthcare providers who are using the tools, we discover that 2% only diagnostic error rate happened. So again, we believe that these studies are empowering our solutions as well as these digital technologies that we can really reduce and to see and our healthcare quality in the healthcare organization are really improved. Last but not least, and we are so proud in Wolters Kluwer that our products, one of the only products in this field, mainly in the CDS field, who are attached with a research and outcomes showed that if you use CDS tools like UpToDate or Lexicon or all other solution we have, you will see that your healthcare outcome are improved by research already there in the market. And this is one of our main proud of that we have such research proven that using UpToDate and other solutions really improve your quality in the hospital as well as shorten your length of stay. Last but not least, for sure, lower the mortality rate. And this study was done for 3 years by Harvard University. And this was the main outcomes we had from these research, again, to agree that our solutions, mainly the CDS tools, very highly needed to improve your outcomes and help you, support you to reach your value-based implementation work you are doing in your organization. So until here, from my side, I'm finished. Back to you, Matt, and thank you all for your good listening.
Thank you very much, Dr. Ahmed, for that presentation of yours just now. We do have a poll question that's just popped up on your screen, which I hope you can answer. So let me just read it out very quickly. Do you have an evidence-based clinical decision support tool in your hospital? And the possible answers are yes, no, we are considering it. So do you have an evidence-based clinical decision support tool in your hospital? Yes, no, we are considering it. And you have roughly 30 seconds to answer. And we should see some results pop up on a screen momentarily. So let's just give it a moment or two. Do you have an evidence-based clinical decision support tool in your hospital? We do have more poll questions coming up as well for added interactivity. And of course, if you do have a question, then please pop it into the Q&A box on a screen, and one of us will be able to address your question later. Okay, we should see some numbers soon. Here we go. Great. Well, thank you very much for all of your responses. Just very quickly, 16.7% in favor of yes. Half of you voted no, and a third said we are considering it. So there we have it, the poll. Thank you very much. Now we're going to move on to the next presentation delivered by Christian Cella. Christian, over to you.
Yeah, hi everybody, and Thanks for inviting me to this webinar in which we're going to discuss how to achieve better outcomes through patient-centered care. And to me, it's really a pleasure to talk about it in this region, in your region, Middle East and Africa, which from our point of view is one of the fastest adopter of new technology and clinical decision support. So really an area in which we do see somewhere a leapfrog versus our other area of the world. Today I'm going to discuss about and with you and present how medication decision support, which are a part of the tools that an organization and hospital and clinician can use to improve patient care. So we have been interviewing and analyzing what are the common challenges that professional and hospital are facing today. And there are two major challenges. The first one is associated to the medication errors. There are almost 43 million adverse drug events that occurs worldwide each year. And this has a great impact for the subject we are discussing today, which is patient harm and quality of care. And the second is also associated to extended length of stay due to this adverse drug event. The second challenge, which sometimes we call the second pandemic, in fact, is the clinician burnout. Pandemic and even previous dynamic were really creating a lot of stress in the clinical workforce. And there are studies from the WHO that measure this impact as 80% of clinicians suffering from burnout. This is having many different reasons, evidently, and one of them, which is related to adverse drug event and medication support, is that sometimes there are alert fatigue from the technology that is getting adopted. The clinicians, therefore, are not really on board in new technology adoption because it's not considered impactful, and this finally might have an impact on patient safety, so sort of a reverse effect. We have run a survey around the globe to ask if medication decision support are considered useful. And as you can see here, 95% of the respondents believe that this is impactful, and it's not a big surprise because there are millions of combinations that can be generated when a prescription with multiple drugs is given to a patient, particularly when it's becoming age or suffer of chronic disease. The second type of takeaway from our survey was that half of the hospitals anyhow, they don't use a medication decision support, or they have not integrated any into their electronic medical record. And when they do have it, they believe that is not providing very precise or advanced alert because they are not using patient information data. So based on this type of input, what we have been doing is to build what we have been calling a maturity model of medication decision support. This tool can be really having a different impact on the organization, its adoption, and the patient safety depending on what they're doing. And we have identified three major variables to assess the maturity of a medication decision support. The first one is the alert precision, meaning how the type of alert that is provided to the clinician is precise versus the patient information. Because if you go to the left, it can be just a very generic alert, and this creates alert fatigue, clinical burnout. The second variable is the efficiency, meaning when this type of alert is provided to the clinical workforce. If it's coming at the end of the intellectual process, evidently this again will have a negative impact on the professional that consider his task finished and will lose time to restart from scratch or getting supported by the pharmacist, while if he's getting on real time, just in time feedback, that is what we call really decision support. And the last one is to support the healthcare organization to check, because these are technology tool content rich, so we can start analyzing which type of alert are shooted the most. What are the more severe alerts that the organization is triggering the clinician, and therefore adjust to drive change over time and also having a positive impact on the knowledge of the workforce. So from the left, basic tools, to the right, advanced tool. When we analyze current ecosystem in worldwide, in the globe, most of the solution stand on the left and did really little progress to move to the right. In Medispan, which is the solution that Wolters Kluwer Clinical Effectiveness is delivering worldwide, we have been working to improve on these three areas. So we have been working on, and I'm going to explain a bit more in detail how we do it, to improve the alert precision, to provide this alert smartly within the clinical workflow. And as Matt was saying in the introduction, this has two major effects that goes back to the major challenges. We are increasing patient safety and clinical adoption. And actually, when a clinical decision support is properly engineered, reduce clinician burnout, because it's becoming a companion in this busy time. And this enrich plus insight to the organization, because we have a clinical advisory team which is made up from pharmacists and mostly, will help to keep optimizing the drug screening with local nuances, and also help to support the accreditation that often, like MRAM level 7, is requiring this type of solution as a must to be achieving the accreditation. Now, let's go to the first variable, which is alert precision. So traditional medication decision support, they just take in consideration the drug that are getting prescribed at a generic level, with very little indication, sometimes even on the dosing quality, very basic indication or known on the age and the gender. So what is happening is the system are shooting too many alerts with low accuracy, and again, lower adoption, high burnout. If we move to what we call advanced or effective screening, here we start adding granular patient information, leveraging complex algorithms that are considering many data fields and are updated on top, last very important things, on a constant and very frequent base. Just to give an example of information that Medispan is triggering, there are the renal EGFR and creatinine clearance data that are really one of the most important input to adjust dosing information, and then giving very precise alert. And we have developed also genomic information, PGX, which when you're talking about multiple drugs in aging population, but generically, are creating much more meaningful alert. And here, as you can see, better clinical adoption and a reduction in clinical burnout. Second variable was the smart workflow, so the efficiency. In the efficiency, when we compare the left side of the maturity model, so the traditional CDS system, we do see that the alert review, and this is also on the manual traditional screening when the clinical pharmacist is doing everything by himself, the clinician enter the diagnosis, search the new drug, add it, put a prescription up, is going to a basic medication decision support or to a clinical pharmacist, and all the alerts are shooted back to the clinician that needs to restart his process. More time and burnout potentially, and alert fatigue. When we talk about smarter workflow, the alert is coming in each single step of the intellectual thinking of giving a prescription. So just to visualize a bit more, I'm a doctor, I'm adding a new drug, and instantaneously into the system, when I'm typing the new drug or the new dosing, I already see that there is a severe alert, a red icon, a red pill, a double pill if it's duplicated therapy, or a dosage icon. And this already helps the clinician to twist his decision and eliminate this type of alert. So when it's coming to the end, to the pharmacist, the alert should be zeroed in a perfect world, or the clinician decided spontaneously to override, and he might have a discussion with the pharmacist why he wants to proceed with that therapy and medications. So how this is reflected into the hospital, and we are showing here a very interesting case in Saudi Arabia. One of the most prestigious hospitals with 1,200 beds was analyzing the clinical validity of 3,000 dosing alert, and he was comparing its medication screening solution that was coming with the EMR they adopted versus a reference database lexicon that is part of our clinical decision support suite. And they were finding out that 95% of alert were clinically invalid because they were overridden 96%. So why they were invalid? Because they were not taking in consideration precise patient data. So this is really showing how having a basic medication decision support has a totally different impact and is what I call a boomerang versus advanced solution. On the contrary, and we wanted to bring another example, we had a case study from a university hospital in Taiwan using Medispan during the beginning of last year, and they just made this study at the pharmacy department level, in which on renal dosing alert, they were showing how Medispan was able to identify more and more precise high severity alert, and just in 4 months generating $500,000 of Taiwanese dollar saving. So I hope that this information are useful, and I'm really excited to see how this region is keep adopting advanced screening solution. Thanks.
Well, thank you very much, Christian, for that interesting presentation of yours. And we do have another poll question, in fact, which should pop up on the screen. Here we go. Do you have medication decision support in your EMR? And the options are yes, no, we don't have an EMR. So you have roughly 30 seconds to select an answer, and we'll publish the results after that time. So a very quick question there. So do you have medication decision support in your EMR? Yes, no, we don't have one. And the results are through. So we have almost a third electing in favor of yes. We have 64% saying no, we don't have an EMR, which is 9% of you. Interesting. Thank you very much for that. Christian, would you be able to elaborate on these results? Do they surprise you?
Well, not too much. It's a common pattern in many geographies, and often when they are available are somehow home developed by the clinical department, or as we said, are basic. So I think there is still a long run and a huge potential to improve patient outcome and patient safety in the next few years.
Super. Okay. Well, thank you very much for that. Do we have another poll question, or is that it? I think that's it. Oh no, there is another one. Beg pardon. So, are you considering adopting this technology? So we do have another poll question. Here's your bonus question, and the options are yes, no, not sure. We are replacing the current solution. So there's your second question. So are you considering adopting this technology? Yes, no, not sure. We are replacing current solution. So you have a few seconds again to vote for one of the 4 options on your screen. Just a quick note, you can actually resize the slides on your screen to make them more visible on your screen. So that's just a quick technical tip. So, okay, so we have the results through. So, oh, wow, okay. So you split down the middle, 50-50 in favor of yes, and you're not quite sure. Christian, what do you make of this?
Well, it's somehow positive because everybody, there is no answer, so it's a 0, and you know, it's consistent with the big openness from this region we have been seeing in the last few years. We have seen a tremendous growth of the adoption of advanced medication decision support, so it's encouraging, I would say.
Super, great. Well, thank you for that, Christian, and thank you again to our attendees for taking part in this poll. Now, moving on to the third speaker. I had incorrectly stated his title earlier. Dr. Sarpa Tanli is actually CEO of Diginova Health. Dr. Sarpa, over to you, please. Dr. Sarpa. I think we'll just wait a moment. Dr. Sarpa, can't actually hear you. Okay, if you just give us a moment while we try to resolve this. Please bear with us while we look at this minor technical issue. Just to recap, Dr. Sarpa Tanli is the CEO of Diginova Health, and he'll be talking around empowering the patient with digital health solutions. I think while we wait, Christian, if you are available, I have a quick question for you about your slides. While we wait for, yeah. So,
can you hear me?
You mentioned, yes, I can. Yes. Oh, is that okay? Dr. Sarpa, you're back.
Yeah, I am. I've been online, but you were not hearing me, so I had to redial.
Wonderful, wonderful. It's great to have you here. Welcome. Great.
Well,
Dr. Sarpa.
I started apologizing, first of all, but then apology got bigger. I just, to everyone, my connection is terrible. Sorry for that.
Not a problem. Not a problem at all. Great. Well, if you could begin with your presentation. Thank you.
Yes, thank you for managing the presentation, Matt, as well. Good afternoon, everybody. I think that what I would like to discuss a little bit today, that what's happening in the digital health world is last couple of years. We can move to slide 2. Definitely a pandemic COVID made a huge impact on the adaptation and flexibility and changes on the providers, regulators, and specifically in our region, in the MENA. And so we realized that such a big impact on the healthcare system made people were thinking about digital health and more and faster adaptation and using to be able to reach the patient. Accessibility obviously was a major issue. So the first thing that we did in using digital health to be able to provide anytime care and virtual care. And what we saw, of course, there was a huge jump to use the digital technology, specifically telehealth. And then we saw that a little bit calm down. But we see now this adaptation is happening, the things are coming back up, is a plateau, as the providers making digital health or telehealth and patient experience a part of their provision. And more and hospital systems, even small clinics, adapting these elements in our role. And during that time, we realized that the importance of data that we've been sitting on and to use it for the benefit of patient experience became much more evident. Because many organizations, from government and public hospitals to systems and hospital chains live on a major data that they don't use and they haven't been analyzed. So, and also during this time, we saw an inevitable increase of utilizing machine learning and using this data to be able to make and support on the decision making, as well as the experience of patients. So if you go to slide 3, what we look at is the future of health is actually today. We were talking about what it is, what's going to happen, the provision of healthcare, and we are used to be able to put our services through, facilities per se, and from urgent care to laboratory and skilled nursing facility, everything. But now, with the digital health and coming in and technology is coming in, and the analytics and information risk certification, and using technology and to our patient engagement and putting the interventions through those systems. And those interventions could be for patients, patient families, and also for the decision makers in terms of when it comes to their care. And definitely utilizing the digital technologies to create a better and care management teams rather than individual connections to the patient. So what we saw that we are able to actually use multiple connection points with the people. And of course, the live chat and secure texting and all that was there before. But now we were able to really look into more and more AI chatbots are coming in place, right? Then we talked about we're using more AI-powered intake forms coming in. And those are the touch points that we are dealing with the patients at the moment. And the symptoms checkers come in place to be able to manage the high volume of interest and increase the accessibility to healthcare. If you can move to the slide 4, what we're looking at is really in that is the way of delivery care is no longer, in a sense, primary, secondary, tertiary, quaternary. Of course, your technical specialty, what we do in terms of the complexity of the cases once the patient in the hospital, it goes beyond, tertiary, quaternary. What we're talking about here is the access to healthcare is not necessarily linked to buildings. Is moreover and how we can provide self-care and preventive health, how we can have multiple connection points of a patient or individual with healthcare professionals, and then how we can really use the technology on the diagnostics and therapeutics, and as well as that how we can follow up with them, not only right after the hospital discharge when they have a big surgery, but also for throughout their life and then well-being and wellness and connected to the entire healthcare system. Of course, it sounds like I'm talking a little bit on population health, and some might say that this is the job of the public, this is the job of the government. But now where we are, and expectations from the consumers as well, they want to be integrated, they want to be connected to their providers, and they want that to be seamless to happen. So that's what we are now talking about in our region, exchange data platforms and initiated by the government. So we can see patient information when they come to me what they were before. So that's obviously going to increase quite a bit of experience of the patient. So when we look at the experience, actually there are things that they don't even see and feel. I think the two presenters before me showed that there are many things happening in the background to be able to provide quality care, to be able to provide safety and better decision support and based on the evidence base. Those are the elements that really most patients don't see. And those are the things comes from their experience when they get better, right? But when they engage with us, how we create that experience and in terms of using technology is the question. So personalization and contextualization is very important when it comes to patient experience. So we are more used to this when the patient comes into the lobby in the hospital clinic, how we take care of them, what to tell them, how to take them to the waiting room, how they've been managed to take it to the operating room, etc. But I think the experience now is beyond that. Experience starts when they're at home. So let's run this for a second, with maybe two personas, I will say. Let's say that Amanda is 31-year-old, marketing executive, very digital savvy, and she has a second pregnancy and it's a risky pregnancy. So her hospital system, care providers provided her an app that really tracks her risky pregnancy and then teaches her what she needs to do, what she needs to eat, and tracks and collects information on a daily basis and to connect to her care team, which is not only the physician, but also the nutritionist and as well as the specialized nurse. And Sarah has a home test kit came, and then the lab results came result of it because the last mile service was completed. So she was able to see all the results without going to the clinic, but she has to go because one of the results are not really good. The doctor wants to see and examine her, and they need to do much more physical exam. And she's able to actually talk to her avatar nurse from the app. And then when avatar nurse comes up and talks to her, is basically a robot, and recognizes her voice that she's not feeling well today. And this AI capability and looks at her other some of the elements that we can see from her voice, but maybe from her face, and what are the things happening with her, and alert her that maybe you need to book your appointment with your doctor much earlier than was originally planned. So when this is happening with this experience, and she is now next day going to the clinic, and clinic sends her a message that on your way, the traffic will be jammed. You may want to leave a little early to your house because they know where she lives. And then when she's close to the hospital, they say, well, the doctor is running a little late. She received a message. Please go to the coffee shop that will come and pick you up from there instead of waiting in the lobby. So such experience to digital connectivity is very critical. But this is an example that I gave you is a marketing executive, digital savvy, 71-year-old Ahmad, and he's had multiple chronic disorders. And as many of the elderly, numbers are growing, how are we going to manage these people with digital technology? And he was as well from the same hospital system, given an app and at the clinic, and they're giving her a Bluetooth technology glucometer. He knows how to use a glucometer. But when he starts using the app, he doesn't understand. He doesn't know what the buttons to push. He doesn't really know that in a so complicated space of the graphical interface. So he kind of puts the app aside, and then he calls the hotline and says, I want to talk to my nurse. So this engagement is very critical when we use digital technology. And I think that for us to be able to reach more and more population, it's inevitable we have to use. So it has to be scalable, but it has to be effective in the blend of the virtual and in-person care. So there's this adaptation that we've heard and talked about, the physician adaptation to digital, is for sure is here for our population too. We cannot take the entire population and say everybody is ready for digital because everybody looking at the Facebook or other social media, and not necessarily. We need to look into the much more sub-demographics and then really define what their journey in this slide that I'm showing, and then how we can put the digital technology specific to their needs, specific to the elderly, specific to the teenagers, specific to the maybe much more disease specific in women's health. So that becomes very critical for us to look at more personalized and more subcategorized elements is critical for us. And finally, if you go to the slide 5, the difficulties in implementing digital health is here. One of is the commercialization part, and then what I talked about, the system, hospital system, clinic provided all of these services to their patients, Sarah and Ahmed, probably not getting paid. So they had a huge discussion before they implemented their solutions because the insurance company has not been paying for such services. And so this reimbursement, user adaptation, and regulation, and also more and more in our region having this type of digital solution designed for us and for our population needs to be there. So we don't really need to say that everything is here. We need to recognize that these elements and difficulties are in front of us, and that we need to create the value for, obviously, for entire health system, not only for revenue generation, but also better service development. And then when we look at that digital health, I just mentioned that the patient's education and engagement, continuous engagement with the digital solution is very critical. And that means that we need to hold hands. We need to explain to them multiple times how they need to be connected for point of care, non-communicable disorders, population health, and all part of the digital solution, a revolution. And finally, that I will say that the technical solutions that relations with the patients are more sustainable. And we need more sustainable solutions. And for that, we need to engage with the people who actually implemented this before. How did they continue patient experience and engagement using digital solutions on every point of touch points that I say when they are at home, when they're at the clinic, when they leave, when they travel. And that's the way that we can really implement and redefine patient experience in this new health system and future of health. Thank you.
Thank you very much for that, Dr. Saper, for your interesting presentation. We, of course, have another poll question, in fact, two, which will pop up on your screen at any point now. And we have it. Do you use hybrid care models? Yes, no, planning to. So there's the first poll question. Do you use hybrid care models? Yes, no, planning to. And you've got a few seconds to vote for one of the three options. And the results should appear on a screen in a moment. Do you use hybrid care models? And the results are through. Okay, 2/3 of you said no, 11% yes, and a little more than a fifth planning to. Very interesting. Dr. Saper, what is your view on this? Dr. Saper, do you have any thoughts on the poll responses? I think there may be another technical issue. Okay. We do have another poll question. Okay. What is the biggest barrier in your organization to deliver virtual or hybrid care? So which is the biggest barrier? There are three: clinical acceptance, patient engagement, technology investment or technological investments. Which is the biggest hurdle or the biggest barrier in your organization to deliver virtual or hybrid care? Clinical acceptance, patient engagement, or technology investments? And we've got a few seconds again to vote for one of the options there. And we should also see the results in a moment. The biggest barrier, the biggest challenge. Is it clinical acceptance, patient engagement? Here we go. And the results are through. So 2/3 of you said technology or investing in technology. 22% patient engagement and 11% clinical acceptance. Thank you very much for all those responses. Let's see, Dr. Sarper, are you available there to share your thoughts on these poll results? Would you have any insights? Okay, I think we might have lost him there. Well, thank you very much again for the poll submissions. We do have time for a quick Q&A with our speakers. We have roughly 10 minutes. So let's begin with the first question that we received from the audience. Christian, I've got a question for you. Can you explain more how the hospital in Taiwan realized the benefits MSC helped them to achieve?
Yeah, so, this hospital in Taiwan is a very advanced country in terms of medication decision support. They have established what is called a national health insurance plan for all the population, and this agency is also defining some strict guidelines around prescription, let's say. And so for this reason, I think almost 10 years ago, they started developed in-house solution or hospital to answer to this mandatory requirement. And they were doing what we call, if you remember the maturity model, a basic drug screening. So without patient information into the screening. When NCKU, which is the university hospital we are referencing here, was adopting Medispan in the first phase, the study was from the beginning of last year, they have been testing into the pharmacy department, and they were screening using Medispan to collect patient information like EGFR, creatinine clearance, and the major impact of advanced drug screening is visible in the dosing screening, meaning that when you have to twist the dosing, the combination are exponentially increasing, and it's very difficult for a basic solution to provide good screening. And given our advanced content, if you remember, point number one was advanced content, we are able to give meaningful alert relating to dosing. And this just in 4 months was generating much more impact than the homegrown solution that is deployed in the full hospital. We were just testing on a subset of prescription that were going to the pharmacy department. So that is a bit more of explanation, and happy to go more in detail in another session if needed.
Thank you very much for that answer. Yes, I can, yes.
Okay, well, I was hearing you all, and unfortunately you didn't hear me. I just wanted to refer back to the questions came in from the poll. Well, I think one thing to say, I'm happy to hear that the hybrid care model is being considered and started being used. And my assumption is that most of those now is on towards telehealth and teleconsultation. So I think that we need to look into how we can create the full scale of the continuum of care, from home test deliveries and medication deliveries at home, how we can manage the patient experience coming to the clinic, how they are experiencing to and connecting with their caretakers at home, and how we're connecting with them. So telehealth is a great start, and hybrid model is, I assume that obviously they come to the clinic and there's a hybrid portion of it. But anything that is a suggestion, any hospital system launching their, everybody now has their, obviously, patient portal. If not, they're working to develop one. If they don't have the EMR, they're going to ask the EMR solution to be able to have the capability. So in whatever that we launch, when it comes to the provision of care and connection to the patients, we should not forget that we need to touch base with them once in a while to see how that experience is going on. Because we're not really prepared about asking questions that how is your digital experience? We're prepared to ask about how is your experience with the receptionist, how is your experience with the nurse. But I think we need to also change and adapt ourselves in the quality metrics and KPIs, how we are making sure that they are connected with us and beyond the hospital walls, and how they are connected and stay with us and for the sustainability of this digital transformation.
That's great. Thank you very much for that comprehensive perspective on the poll results just now. It's very interesting. And thanks also, Christian, for your answer earlier. We do have time, 4 minutes, for one more question. This relates more to burnout. And of course, there was that burnout statistic that I saw earlier in the slides, which I think was 80% experiencing burnout, which is astronomical. How do we reduce clinician burnout? So this is a question from the audience. How can this be effectively reduced? I'm wondering, Christian, if you can answer this one as well.
I believe really the reduction of burnout might be driven by the hospital C-level and the management of hospital through a wider set of initiatives. I'm going to answer in relation to what I believe we can support and control, and I'm most aware, which is what I was trying to explain in the presentation related to technology adoption. I believe technology can be really being a boomerang, or can be really going in the positive direction or in the negative direction. Often technology is an additional layer of complexity, change management, and is creating more burnout. I believe that in reality, technology is one of the biggest levers to reduce it, if done properly, and the adoption and the rollout of this technology should be really done hand to hand with the clinical workforce to build acceptance, but also through technology that are really providing added value and reduce the task or the effort that the clinical needs to do in a day-to-day. So going back to what I was explaining in the medication decision support, it's totally different to see an alert when you're making a decision and you stop a wrong decision that can become an additional loop of technology or manual debate, therefore time, stress out, debate with the pharmacist, and restart, or having a support that is stopping a wrong decision at the root cause. So that is one small piece. I know that for clinician, the burnout roots are many more than just technology, but I'm trying to answer for that piece that I believe relevant.
Yeah, thank you very much, Christian, for that answer. It's super interesting insight into technology. Of course, it's had a big impact on all of our lives, whether in healthcare or not. And I expect there to be even greater changes in the years to come. And on that note, we're going to have to wrap up this webinar for now. Thank you very much for our distinguished speakers who joined today. And indeed, thank you very much for all of you who registered today to follow this webinar. Thank you all.
Thank you.